Welcome to the podcast series Unshakable Strength, Empowering Black Women, sponsored by the Empower Project. The Empower Project is a partnership between Howard University and Health HIV, sponsored by the PACE grant from Gilead Sciences. The Girlfriends podcast is dedicated to addressing the unshakable strength shown and the unique health challenges faced by Black women and girls, particularly in the context of HIV prevention. We will explore important topics such as sexual health, mental well-being, access to healthcare, and strategies for HIV prevention tailored to the needs of Black women and girls. We invite you to listen to our other episodes that explore important topics like Beyond the Role, caregiving, self-care, and HIV prevention, and so many more that are already available for you. Today's episode is When Love Hurts, Intimate Partner Violence, HIV Risk, and the Path to Empowerment. This powerful episode delves into intimate partner violence through the lived experience of Black women, revealing how abuse can erode autonomy, increase HIV risk, and limit access to prevention tools like PrEP and testing. It highlights the urgent need for trauma-informed, culturally affirming support that addresses both safety and sexual health. By connecting intimate partner violence and HIV prevention, the episode underscores the importance of empowering Black women with the resources and care that they need to heal and thrive. Today, I have the honor of introducing my guests, Ms. Marnina Miller and Ms. Tana Pradia. Marnina Miller is a human rights activist and co-executive director of Positive Women's Network USA, where she champions the leadership of women living with HIV. As a health, not prisons advocate, she works to decriminalize HIV in Texas. Through her platform, Marnina the Queen, she engages a wide social media audience to spotlight injustice and inspire change, reaching millions across TikTok, Instagram, and Facebook. Tana Pradia, a mother, grandmother, and great-grandmother, has lived with HIV since 1999. After surviving TB and a critically low T-cell count, she began advocacy as a patient mentor at Thomas Street Health Center. She now chairs the Ryan White Planning Council, co-founded Positive Women's Network Texas, trains with the AIDS United POP grant, and serves as secretary of the Texans Living with HIV Network. Tana credits her advocacy with sustaining her sobriety and continues to dedicate her life to empowering others and strengthening her community. Good afternoon, Marnina and Tana. Thank you both so much for joining us today.
Thank you for having us.
Yes, thank you so much.
Absolutely. Two amazing women. I'm excited to hear your voices. And so we're just going to jump right in. And I'm going to start with this very first question. And I'm going to pose it to Tana, but either of you can jump in at any time. So, Tana, thinking about your own journey, what kinds of care or support would have made a real difference when you were trying to navigate intimate partner violence and being recently diagnosed with HIV?
So, that is a great question because my journey through intimate partner violence and HIV dealt with a mental breakdown. And when that diagnosis came, I was in a mental hospital because of the abuse that I went through with my partner. So, as far as healthcare goes, the psychiatrist assumed that I knew that I was living with HIV, which was a false statement because I had no clue that my partner was living with HIV. So I went through another major breakdown all at the same time of being in a mental institution, but also finding out that diagnosis in a hallway, not in an office, but in a hallway. So that journey for me was not the best. But I will say that I survived it. But it took many years. It took me about 10 years to get where I'm at today.
Wow. That is so sad that your journey had to start out so negatively, but I'm so glad that you said you survived it
Yes.
because so many others have not.
Yes.
So many others have not. Marnina, let me ask you, in light of that statement, what are some of the biggest systemic barriers Black women are up against when it comes to accessing resources, when experiencing intimate partner violence and living with HIV? What does that look like?
Oh, that's a good question as well. Like some barriers are obvious, like the lack of insurance, limited shelter beds and intimate partner violence shelters, stigma from healthcare providers. But the deep barriers are about how these systems are built and created. Shelters aren't typically trained on HIV specific care. So women are forced to choose between safety and HIV stigma. And healthcare settings don't always screen for violence. And when they do, it could be judgmental instead of supportive. HIV criminalization is also another barrier. HIV criminalization laws exist in 30 states across this country, and they make women afraid to disclose their HIV diagnosis or to seek help, especially when their abusers threaten to weaponize their status against them. So, intersectionality really teaches us that Black women experience these barriers in compounded ways, whether that's like racism in healthcare settings, sexism in the court systems, stigma within the health in shelters and healthcare spaces, and also like the intersection of classism in like the economy. And so poverty and racism really magnify all of this for Black women. The barriers are not just personal, they're also structural and rooted in a system that was never designed for us in mind. That's why we really look at Positive Women's Network. We call HIV a racial and gender justice issue because when they intersect, they become so dangerous for us. And so that stigma is compounded.
But
Listen,
also,
all the
that stigma,
snaps. Go ahead.
that's yeah, that stigma in the healthcare setting is truly not set for Black women.
Mhm.
And this journey of how do I deal with it, but also how do I deal with systems that was not designed for us, by us? Because one of the things is that healthcare professionals think they know what's best for us. And when we think about, and they'll throw data in the mix of it, we all live in the same communities. We don't have sex any different from our white counterparts, but we have a high diagnosis. But also, one of the things is healthcare professionals think that our walks of life are the same, and they're not. Each Black woman's journey is totally different. For me, I wish that I had someone as, and Marnina is my daughter. Uh, I love her just like I birthed her. Is that I wish I had someone in the beginning of my diagnosis that I could go to, I could be transparent with without the stigma and the discrimination. Because one of the things is my partner used the disease against me to keep me trapped in an unhealthy relationship. And it took me 6 months after my diagnosis and almost dying in that relationship before I actually got the courage to leave. And by that time, I lost my dignity, I lost my self-esteem, I lost my career, I lost my children who I thought I lost, but I really didn't. But I lost so much behind the shame, the stigma, the discrimination. And it took me until really, I would say 2014 to get where I'm at today. And I had to learn truly how to love myself for who I was, not for what other people thought I was, truly for who I was and the woman that I am today.
Mm, I love that. I love you are speaking words of empowerment, which is what all of this is about. So Tana, I'm gonna bring this back to you because you're in a different place now. You have survived, like you said. And so now, despite these systemic barriers that she was talking about, what helps you feel seen and heard and safe in healthcare or community spaces? And what are the things that they do that tends to shut you down?
So, I think one of the main things is really assuming that I don't know how to take care of myself, my health, but also thinking that they can make the decisions for me, what's best for me. And in the beginning, that shut me down because I wasn't being heard, I wasn't being seen, and I was already at the bottom. So, those types of bottoms is where we have suicide, where we go into addiction, because I lived in addiction for 15 years due to my intimate partner violence. And that was like a merry-go-round for me. Um, and that was a way my addiction kept me where I didn't want to think. I just wanted to stay high. And so, in order not to deal with providers or anyone, I just stayed high. Uh, and that was a death sentence for me. And when I say death sentence, I mean I was literally trying to kill myself.
Wow. I hear you speaking, and I know for a fact there are listeners who your words are resonating with them, or there are some women who are experiencing similar journeys than what you're describing. And I know Positive Women Network is all about advocacy, and it's all about uplifting women who are positive and have experienced journeys like this. So Marnita, when we look at, let's be real, the current political landscape, or the current landscape of the United States, where there are issues happening with healthcare and reproductive care. How do you see this landscape connecting to the safety and survival of Black women living at this intersection of intimate partner violence and HIV?
Oh, just hearing Tana's story and also thinking about this political landscape is so disheartening for me. It just breaks my heart because I know that, and we all know that when you are living with HIV, and Tana can probably attest to this, it feels as if your body autonomy is taken away from you. The rollbacks of like reproductive rights, attacks on gender affirming care, and now like the cuts to the safety net programs, these are not separate issues. They are all a connected form of control over our bodies. And women living with HIV know this more than anything. And so when we talk about how these attacks show up, they are compounded for women living with HIV, as we already live in multiple marginalized identities. For Black women living with HIV and surviving IPV, don't also add an additional layer of being queer or trans on top of that. Every attack chips away at your survival and your safety. If you cannot access abortion care, for instance, and if Medicaid expansion is blocked in your state, and if your HIV meds are being at risk for being cut because of federal cuts, your safety is threatened at every level. And data shows us that Black women make up almost 60% of all new HIV diagnoses in the United States, despite being 13% of the population. And one of our mentors, Benita Ray, also says that data without the full story is violence. So I want to say that that's not by accident. It really reflects structural racism and gender equality in the HIV movement. The fight for reproductive justice, healthcare access, and HIV resources is a fight for racial justice and gender justice. You can't separate them because our survival is bound all up in those. And so I often like to say that if you give Black women the resources that they need to live and thrive, you heal a entire community. So if you fix it for Black women, if you fix the system for us, then you fix it for everyone.
Mm. Fix it for Black
Absolutely.
women, fix it for everyone. I love that.
Absolutely.
Love
Yeah.
it.
So I
Mm.
would even say, this political landscape is really educating, but also being able to be vulnerable, being able to be transparent. Because one of the things is in this work I've been into, I am very unapologetic as a Black woman, but as a Black woman living with HIV, I believe in educating my own daughters, granddaughters, also my nieces, but also my grandsons. Because one of the things is, as Black women, we need our Black men to step up
Yeah.
and do their part in these political attacks on Black women's reproductive rights. Because when I think about myself as a mother, and I'm gonna use me as a mother, I don't want my daughters to have to go through what I went through. I don't want the next Black woman to get a diagnosis. So if you are going to take away health care, if you're going to take away abortion care, every woman's body is different. So her body might reject being pregnant. So here in Texas, a woman can be criminalized for just having a miscarriage, and that is taking away our rights as Black women, not hearing us, not seeing us, but also not listening to us. And we have a right to voice how we feel. We have a right to challenge systems that are not for us. And as far as I am concerned, I'm going to stand, I'm going to fight, and I will fight on the front line for every Black woman living with HIV, no matter what anybody says.
I love that. We've got to fight. And so I know that there is this thing that PWN, Positive Women's Network, created called the Day of Action to End Violence Against Women Living with HIV. Talk to me about that.
So, the Day of Action to End Violence Against Women Living with HIV was created because structural violence has always been a part of the HIV epidemic. Not just in the way the virus itself operates, but the way in which women are criminalized, shamed, and made unsafe for living with HIV. Studies show us that 50% of women living with HIV will experience intimate partner violence at some point in their lives, a rate that we know is way higher than the general population. But those numbers still don't tell the full story. Violence shows up at our jobs after we disclose and like our coworkers don't want to sit next to us. They also show up in housing instabilities and the ways in which we're unable to access safe and affordable housing. It also shows up in being denied health care or being judged at the very clinics that we are supposed to find our healing. So, using this intersectional lens, we know that women face overlapping forms of oppression: racism, sexism, homophobia, transphobia. They all make violence so much more harder to escape. And so, Positive Women's Network created this day because HIV is not just a health issue, and the epidemic doesn't end until all women are safe. And so, naming that this violence is resistance and demanding accountability is the way that PWN allows for us to not only be visible, but for us to also advocate for ourselves in a really powerful way. And I love that Positive Women's Network is by women living with HIV and for women living with HIV. So, as a woman living with HIV, myself and my other co executive director, we're both women living with HIV. Our board of directors are 100% women living with HIV because we know that no one is coming to save women living with HIV. We got to do it ourselves.
Absolutely. Absolutely. And
100%.
I will add one thing to that, because as one of the co founders here in Houston, but also sitting on the board of directors, is that we are saving each other. PWN has saved my life through my addiction, through my IPV, all of that, it has saved my life. It has given me something that I never thought I had. Because honestly, I didn't have a community that of women like I have now. We stand, we fight, and we deserve the quality of life that everyone deserves as women living with HIV. But also, it is about we have built a sisterhood. This is a family. We stand, we fight together.
Absolutely. Absolutely. So, to anybody who may be listening and they really want to show up for Black women at this intersection of intimate partner violence and HIV, what's one piece of advice that you would give to them, whoever's listening, that really wants to begin to join this fight?
I would say join Positive Women's Network USA. Join our listserv. We have so many opportunities for allies. We actually call them accomplices because we don't want folks who are just going to be on the sidelines and wave at us. We want you to join us and get in this fight and get on the driver's seat with us. And so become an accomplice with us. Join our networks. Join our chapter work. We have 9 chapter states throughout the country. Donate to people living with HIV led organizations. We are the ones that we have been waiting for. And so donate to us, join our movements. And I would also say, watch your language. We don't always know how powerful language is when talking about the HIV epidemic. So use people first language when talking about people living with HIV. I'm not infected. I'm a woman living with HIV, and HIV is living with me, and I'm thriving because I have decided to not let HIV control my life. So make sure you're using a empowering language when talking about people living with HIV.
That's good. That's good. Miss Tana, any parting advice?
Yes, I will also say that HIV doesn't have a look. HIV is a small portion of our lives, but it's the most important portion because of healthcare. But what I will say for any Black woman, Marnina said it beautifully, join PWN. Go on our website at pwn/usa.org and donate to us. But we are in this fight together. If you want to know more, join this fight, donate to this fight, because the more people we have and the more women that feel that they can trust us and be transparent, this is the organization that you need to be a part of, because this is who saved my life and is still saving my life today.
And also, too, Amy, if you're going to create programs that you think women living with HIV need, ask us first. Pay us for our
Absolutely.
expertise and build it alongside us. Because safety is not a one size fit all, and we are not a monolith. All women living with HIV have different needs. For some of us, it's housing. For some of us, it's legal help or peer support or simply being believed. And the best advice that I could get is to trust women to lead. Intersectionality teaches us that our survival is more than just an HIV service, an IPV service. It's about addressing those systemic barriers, racism, gender equality, poverty, and violence all together. And so, the most powerful thing that an organization or company or someone that create programming can do is not to just serve us, but to stand by us as we continue to build those programs that we so need for our own survival.
I love
And
that. You
also,
serve us, stand by us. Yes, Miss Tana, go ahead.
absolutely, stop saying that you can design something if you're not a Black woman living with HIV for us. We know how to design something and build it from the ground to make it something that is powerful. Because if you are not living with HIV, you don't know what that daily struggle is about. You don't know what we go through on a daily basis to get where we are today. And it's about joining forces, but also listening. to women living with HIV, because we are the change that we want to see. And we are building a movement for resilience, for liberation, and for freedom.
Yes. Wow. Thank you so much, Marnina and Tana, for sharing your powerful insights and lived experiences and for shedding light on the critical connection between intimate partner violence, HIV risk, and empowerment. I can guarantee somebody who's listening or watching has been moved by the words you've said. And I know that somebody out there who's living with HIV needed to hear those empowering words from you both. So thank you. Thank you for your time. And to our listeners, thank you for tuning in to this episode of our podcast. We hope you found the conversation both moving and informative. Be sure to join us for our upcoming episodes covering topics like exploring faith, sexuality, and empowerment for Black women, along with many more important conversations. Remember to subscribe, rate, and review our podcast to help us reach more listeners. Until next time, have an amazing day, and thank you for listening.